Many men don't realize that their sexual organ, like every other part of the body, ages over time. It loses blood supply, elasticity, and sensitivity, just as bones, muscles, and the heart do. Neglecting this issue and failing to get proper care can lead to serious consequences. Diminished erection quality, reduced sensitivity, changes in size, and a loss of confidence. Dr. Enrique Navarro, a clinician with more than 40 years of experience working with older men, can confirm this from my practice. I often see patients who attribute intimate problems to old age, unaware that the real cause lies in everyday mistakes, often driven by lack of information. Most sexual problems after 60 are not the result of age, but of habits no one taught us about. And believe me, by making only minor adjustments, you can radically improve your intimate well-being. In this video, I share information about 6 common problems that can negatively affect sexual health in older men. Moreover, I will show you how to address them effectively, safely, and without medication. At the end, I will offer a simple natural home recipe, backed by scientific rationale, that can help clear the vessels of the sexual organ and improve blood flow in this area, which is crucial for preserving intimate strength in later years. If you're already over 60, this material is for you. Many older men make one main mistake. They believe their sex life ends after 60. This is perhaps the most common and dangerous illusion I encounter. A short stretch of discouragement, one episode of an unsuccessful erection, or a cooling of the relationship with a partner, and a man exclaims, "It seems my intimate life is over." Once this negative mindset takes root, it begins to influence the body as if proving itself true. The male's sexual organ, like the heart, muscles, and brain, is living tissue, rich in blood vessels and responsive to stimulation. To maintain normal function, it needs constant stimulation, like any other organ. When a man becomes convinced that the situation is hopeless and stops self-stimulation, loses interest in his own body, blood flow to this organ worsens, oxygenation declines, sensitivity is lost, tissues become denser, and sexual response weakens. Doctors call this condition disuse atrophy. Stagnation doesn't arise because of age, but because needs are ignored. Fortunately, this process can be stopped and even reversed. You don't need intercourse to do it. It's enough to practice mindful masturbation, perform pelvic floor exercises, use medical vacuum pumps, or any other methods that improve blood flow and stimulate circulation. This matters not only for preserving sexual function, but also for overall well-being. Sexuality is a vital component of a man's self-esteem, sense of presence, and life energy. Ignoring it strikes not only physical health, but also emotional state, self-perception, and connection with the world. I have seen men who, once they began caring for their sexuality again, brought smiles back into their lives, regained a sense of attractiveness and confidence in their step. Not because they wanted to be young again, but because they realized they still possess value and strength. And that value begins with caring for what many pretend no longer matters. Your body still responds. Your function can still be preserved, but only if you refuse to believe it's too late, because it isn't. Mistake number 2 is replacing real desire with pornography. In later life, many men find themselves alone. Some have lost a partner, others face distance, routine, fatigue. In that silence, they start seeking pleasure where it's easiest, on a screen. Pornography seems harmless. One video here, another there. But what begins as a distraction gradually becomes a trap that suppresses true desire and disconnects the body from the real world. When the brain gets used to intense, fast, solitary stimuli, it begins to reject real touch, real skin, real time. During intimacy, desire seems to appear, but the body doesn't respond, the erection weakens, presence fades, connection is lost, and a man starts to think the problem is in his body, but it isn't. The problem is in a brain trained to seek a pleasure that doesn't exist in real life. Over time, this habit pushes you even further away. Shame comes, guilt, the feeling that you're no longer a man. All this is invisible to others, but it can be changed. Reducing pornography use is not prohibition. It's liberation, a chance to let the body feel again for real. It's a return of pleasure through imagination, through touch, through closeness that you build rather than that a screen imposes. Talk, explore, feel. Without haste, without pressure, desire is still alive. It simply needs to reconnect with reality and with the person beside you. Real pleasure is not what you watch alone, but what you feel together. Mistake number 3 is engaging in intercourse without a full erection. Few speak about this, yet it is one of the most common and dangerous mistakes I see in older patients. Eager not to miss the moment or afraid of disappointing a partner, many begin intercourse before the body is ready. What seems a minor lapse can leave internal traces no test will show until it's too late. The male sexual organ consists of delicate, well-vascularized tissues. It must be fully rigid to withstand friction, movement, and pressure during intercourse. When this isn't the case, microinjuries occur, tiny invisible tears that over time turn into scar tissue. These scars start to pull on tissues, deform the organ, and in many cases lead to a condition called Peyronie's disease, a curvature that can cause pain, hinder penetration, and at later stages even make sexual life impossible. The saddest part is that most men seek help only when damage is already done. Many don't even suspect that the cause was that hasty moment in the past when they decided to start intimacy before the body was fully ready. But this can be avoided. Rule 1 is simple. Never begin intimacy without a full erection. If you take medication, give your body time. Use lubricant. Prolong foreplay, touch, and closeness until the erection is firm, stable, painless, and without doubt. This is not insecurity. It is maturity, respect, and care. By preserving your tissues today, you safeguard your function for tomorrow. There is nothing more manly than protecting your body wisely. Mistake number 4 is neglecting intimate hygiene in older age. It's a delicate topic, but it must be discussed openly. Many older men still don't know how to care properly for intimate hygiene and pay a high price. Most don't notice, but the body changes with age. The skin becomes thinner, natural defenses against bacteria weaken, and what once seemed sufficient, like just rinsing with water on the surface, stops being effective. The result is irritation, unpleasant odor, recurrent infections, and even more serious problems such as balanitis. In extreme cases, there's even a higher risk of penile cancer. This reality is more common than it seems in countries like Brazil, where intimate hygiene is still taboo. Uncircumcised men are at even higher risk. Keratinized cells and secretions can accumulate under the foreskin, becoming an ideal breeding ground for bacteria. The solution is simple and quick. Wash daily with warm water and neutral soap. If you have a foreskin, gently retract it and wash thoroughly underneath. Rinse off the soap completely and dry with a clean towel. Don't leave the area damp or constricted by tight underwear. Moisture is a breeding ground for infection. One important detail: after any sexual contact, repeat hygiene. Fluids, sweat, lubricants, all of this can alter the skin's pH, cause irritation, and create conditions for harmful microbes. This care takes less than 2 minutes, but can save you days or even weeks of pain, discomfort, and treatment. In older age, wisdom means prevention, and prevention begins in the shower. Mistake number 5 is relying only on pills and forgetting the essentials. Most men come to the doctor with the same hope: a magic pill. They want a drug to restore desire, strength, confidence. But what almost no one realizes until it's late is that no medication can replace a healthy foundation. An erection is merely a reflection of a much deeper process: the state of your circulation. If blood doesn't arrive with the necessary force and stability, the issue isn't desire. It's clogged arteries, inflamed vessels, a heart worn down by harmful habits. Smoking, excessive alcohol, lack of sleep, chronic stress, all of this wears the body down from within. The first warning sign doesn't appear in the chest. It appears below. Yes, in many cases, erectile dysfunction is the first sign of an impending heart attack. Relying only on a pill in such cases is like painting the walls of a house that's about to collapse. The good news is the body responds quickly to change. Quitting smoking improves blood supply within days. Replacing alcohol with water helps hormones rebalance. A daily light walk strengthens blood vessels and lifts mood. That's when the body starts working. The solution arrives before the pharmacy, and it changes not only your sex life but your health overall. Medication can be a support, but the true power lies in what you do every day, in what you put on your plate, in how much you sleep, in the respect you show your body. Don't shift onto a pill what only you can build. Mistake number 6 is sleeping in tight clothing that chokes your intimate health. It may seem harmless. You fall asleep, tired, in the same underwear you wore all day, and don't think about the consequences. But this unnoticed habit can cause irreparable harm to one of the most vulnerable parts of your body, your intimate organ, especially after 60. At night, the body mobilizes to recover. While you rest, blood flow and oxygenation improve, and even the intimate area participates through involuntary erections that keep tissues supple, perfused, and healthy. But if you sleep in tight underwear, constricting briefs with tight elastic bands, or in poorly breathable fabrics, this natural process is interrupted. Compression disrupts proper circulation, irritates the skin, and impedes free blood flow. Over time, these micro-injuries, though invisible, leave indelible marks on the cavernous bodies, the structures responsible for erection. The resulting scars pull and deform these structures, cause pain, and can progress to serious problems such as Peyronie's disease, characterized by painful curvature that makes intercourse difficult or even impossible. The consequences can be even more significant. Lack of ventilation creates favorable conditions for fungi, bacteria, and inflammation that can affect the most sensitive area. To avoid this, it is recommended to sleep without underwear or to choose loose, breathable cotton garments. Let your body work at night without hindering circulation or the natural preservation of masculine energy. It's a simple yet effective step which, repeated nightly, can be decisive between aging with vitality or with needless limitations. Mistake number 7 is a bonus, a natural recipe for cleansing the vessels of the sexual organ. After 60, one of the chief enemies of intimate health is the silent clogging of vessels. Over time, the veins and arteries that nourish the sexual organ become stiffer, narrower, and inflamed. Since erection is closely tied to blood flow, any, even minimal, narrowing adversely affects firmness, sensitivity, and sexual response. Fortunately, there are natural methods to counter this. One is a simple yet effective recipe that helps cleanse vessels, improve arterial elasticity, and restore the body's former strength. Prepare it as follows: 1 clove of raw garlic, thoroughly mashed, the juice of half a fresh lemon, squeezed immediately before use, and 1 teaspoon of natural honey, a small piece of grated ginger, about 1 teaspoon, 100 milliliters of warm, not hot, water. Mix everything in a glass and drink it every morning on an empty stomach. Garlic is a natural vasodilator that helps lower blood pressure and reduce vascular inflammation. Lemon is rich in antioxidants and fights fat deposition in the arteries. Honey balances and softens the formula while providing natural energy. Ginger improves circulation and enhances the effectiveness of all ingredients. Many men report that regular use leads to better well-being, erections, and sensitivity without medications and without side effects, thanks solely to consistency. This approach isn't magic, but the simple application of scientific knowledge in daily life. And it can be the first step toward regaining what seemed lost. To sum up, we conclude this video. If you've watched to this point, you have understood intimate health is not a luxury, it is dignity. After 60, every decision matters. Every action, every habit, every effort can make the difference between preserving function and gradually losing what still sustains your vitality. Most men realize this too late, but you now possess knowledge most never receive. The next step is yours. If this video was useful, leave the comment, "I take care of my intimate well-being." Rate it on a 10-point scale, and be sure to share it with someone you care about, because he too deserves the chance to reconnect with his body. This could be the start of a new stage filled with energy, confidence, and pleasure, instead of another night of silence. See you in the next video. M.